Thank you, and it's joyous to be part of this today. So next slide, please. I am Rachel, so I'm on the left-hand side of this slide. So you might be thinking, who on earth are we? So we thought we'd share a slide with members of the team from the work that we're doing. So my name is Rachael Colley. I'm a registered dietitian. I've been a dietitian for 25 years. 23 of them I've been working in the NHS. Mainly in Swindon and Wiltshire, so there may be a few familiar faces online at the moment. So I've worked in weight management, I've worked in learning disabilities, I've worked with long COVID. And now, however, I'm a freelance dietitian. So hence I'm able to work with Sport for Confidence, and this is part of that, and I'm delighted to be doing that. I also, just in case it's interesting, I I'm a volunteer for the British Dietetic Association, and I work with their learning disability subgroup, and I'm the education officer for that group. And as well, I have facilitated training for dietitians on behalf of the British Dietetic Association with regards to assessing capacity regarding diet, weight and health. So I have a real investment in the work that I'm doing here with the lovely Victoria, who I can't see, but Victoria,
I am here. Hi, I'm Victoria. I'm an occupational therapist. I'm also a sensory facilitator. I'm based at Sport for Confidence at the moment, and I'm not sure if you're familiar with Sport for Confidence, but we started by adding an occupational therapist in leisure centres to make physical activity more accessible to those with learning disability, mental health, physical needs, anyone furthest away from sport. And that's progressed onto us looking further afield as physical activity and looking more at how we can support someone's overall well-being. Alongside us, we have Kate. She's a specialist wellbeing and public health officer for Essex County Council. And Michelle, who is our health and wellbeing mentor. She specialises in education and teaching around cooking, meal prep, and everything fabulous like that. Next slide, please. So this started because Essex County Council released a 10-year approach, and it has three main outcomes, and that's the healthy weight environment in Essex, more people with excessive weight effectively supported to be a healthy weight, and healthy lifestyle behaviours are easily and more accessible. And it focused on 7 priority settings. So that's school and food, public estate, travel, green spaces, nurseries, early years, food hospitalities, supermarkets, and business and workplace. And then it focused on 6 priority cohorts, and we focus on those with physical and developmental conditions and learning disabilities. And that's basically what we're aiming for. We decided that the best way for us to target those with learning disabilities was to focus on those in more restrictive environments, such as care homes, and target the carers working in that sector. Next slide, please. So this is our pilot that we're part of. We're very lucky to be part of it. It seems a little overwhelming as we go through it, but we'll try and make it as clear as possible. So we already know that there is a need for more education, more weight management services, and more advice for people with learning disability. So we knew that we needed to make a better dietary intake, improve weight management services in Essex, and improve overall well-being of those people with learning disability. And we really want to aim to the prevention of secondary conditions, such as mentioned, the heart disease, and those that are leading to an earlier death. So we had a listen and learn in phase 1, where we created a survey and sent it to over 200 care homes in Essex. We held online drop-ins where carers could turn up, voice their concerns, tell us in a real nice and safe environment what the issues are. We had interaction at the leisure centres, so we work in over 12 leisure centres in Essex. Lots of our participants do have a learning disability. Many of them come with care staff. So just having that real organic conversation about finding what the issues are and just taking it one step further than the e-learning for health module. We then created a training programme for phase 2, And this is where we took the main themes from the listen and learn phase and we analysed a further training programme. Our main focus is to empower the care staff and address the concerns that they are raising. They have such a broad scope of knowledge that to cover all of that and work from a real carer approach was important to us. We're going to start moving on to the next phase of our pilot soon, which is the in-house practical training. This is where we bring further mentorship into the home. So we're looking to bring our dietetic and OT interventions into the home. We're looking at doing some sort of fun, come dine with us celebration. We're creating a recipe for wellbeing book and really targeting more individualized support for those that have more complex needs. Throughout this programme, we are doing evaluations. So that's evaluation forms, case studies, reports, and reflective practice. And so at the end, we can really provide a beautiful overview of what we found. Next slide, please.
That's back to me, thank you. So I just wanted to say a few words about the training programme. So if you start on the left-hand side of the screen, with the preparation of the programme, that's where I was heavily involved, and just thank goodness for e-learning for health. So we referred to that a lot. So thank you so much, because actually starting from scratch, it's really quite tricky to do. As Victoria said, we use themes in the training from Listen and Learn, and the real focus was on the carers who day in, day out are working and supporting adults with learning disabilities. So we really focused on them and what do they need to know and understand for their role. Just to reiterate, as you can see, it's a real collaboration. So Victoria and I work together, an occupational therapist and a dietitian, and we've had fun, as I hope you can see. And we keep saying we're audience focused. So we really did sort of drill down, and in the 3-hour presentation that we had available, we thought, okay, 3 hours is actually quite a long time. It can't all just be listening. So there's got to be practical elements. We did use e-learning for health, but there is so much in that. We could have filled a day of training, if not a week, but we had 3 hours. So we hoped to make it very practical, very a safe space. I think that was a key thing. Make it a safe space so that the carers who came could feel safe to spark ideas off each other and just think and have that space to ask questions. So the presentation itself, as I've said, was 3 hours. As you might have gathered, well, you might not have gathered, I'm in Wiltshire. And the training was in Essex, so we did have a live link where I was ready for any questions and answers. But it was there were practical sessions within the training, especially to guess the number of sugar cubes in certain drinks, which went down very well, I can tell you. Looking at the top of the slide, capacity focus, yes. The e-learning for health is brilliant. A lot of information in there. But as we went through the training, we tried to keep, as I say, we thought about the audience a lot. And so after we'd done some delivering of what to eat and maybe what to reduce and why, we were mindful that carers would, if they didn't sort of call out to us, they would have been saying, well, it's their choice, it's our client's choice, so what can we do? And then we led into information about thinking about capacity. So we did use the Learning for Health slides, and I hope that we empowered them to think, oh, hang on, if I'm noticing some behaviours, or there's precedent, or there's a previous diagnosis, should I as a carer be thinking, oh, is it a capacity issue? And then as designing the training programme, we were very mindful that if it is a capacity issue, then actually it opens up a whole can of worms in terms of all health professionals and social care professionals. We all need to be working together holistically and with the same understanding, which as a dietitian, I mean I train dietitians, but I'm very aware as a dietitian as well, unfortunately I encounter social care social workers and some in social care saying, no, you can't do anything because it's a deprivation of liberty. And so moving forward, we definitely need to get that understood by everyone, so we're all working together. Part of the program as well, in going back to the training, we also tried to empower the carers to think, okay, and this was based on e-learning for health as well, but what could they do in the here and now while issues about capacity are being resolved locally and maybe nationally? You know, for example, who should be doing the capacity assessments? Are you employing dietitians? Are you employing a proper learning disability team? But while all that's being sorted out, what could carers do? So could they rethink using food as a reward? Could they definitely notice behaviours of concern? But then the genius of what we're doing with Sport for Confidence is about thinking about getting people involved in cooking. Victoria, over to you.
So during the training program, we wanted to create a really safe space. We were aware that we aren't carers, we're not necessarily always in that space. So create it to be a really nice peer support group where a carer could come in and say, I've got Jeff, he's having this problem, I'm at my wit's end, my manager's not listening, what could I do? Just having that chat between different care homes and having that organic conversation, sharing ideas, was actually something that probably carers took away a lot more. We're really promoting that blue sky thinking for carers as well. So what would your ideal job look like if you've got someone that does have behaviours of concern? What's your strategies? What's your policy and process? So that was a really nice open space that we didn't expect to happen. Ongoing from this, we've kept the support going, keeping in touch with care homes, evaluation of our own work as well and what else they want to see. We've had a really positive outcome so far. Everyone that's attended the training, it's been across 8 different sites in Essex so far, have all come back with positive feedback of that initial how to change something, how to get positive change. Next slide, please. So the next phase is where we visit the care homes. We're going to start supporting care staff and residents. We're going to start applying the techniques we've learned, the how-to tips and tricks, nudging and grading techniques. We're going to start looking at triggers, behaviours of concerns, and any weight management tips. We've also started to create, following a 2-week meal plan, a recipes for wellbeing book. And this is going to be like a cookbook that's going to have sensory triggers, symbols, advice for carers, some occupational therapy activity to go alongside with it, anything to increase engagement. What we're hoping to do is to get some of our residents with a learning disability to come in and film videos. So it's lived experience that we're sharing with the group. We've added a user guide, so that's going to have a little bit about food sensitivities, food triggers, possible ways to overcome barriers. And our goal is to provide care staff with all the information, anything just to prompt an idea. Oh, I know one of my residents has got this, someone's got that, why don't I try this? Just to support the involvement. And we really want carers to feel empowered. We're hoping to do a celebratory come dine with us. We're hoping to get enough care homes that we can do a fun, reflective engagement where we can say we can all make a plate, give it a go, just a real fun sharing and learning in a way that we create momentum. And if people know what they're eating, then they're going to start being more aware of possible weight management. We're going to look at building a plate of the week. We want to build a community that kind of runs without us. We want to create that learning disability weight management service, and we want to push that forward sort of out into the future. And I think for us, it's just knowing what does come next. Next slide, please.
Well, I hope you're all listening going, wow. when I heard Victoria saying all that, it really is wow, honestly, and I'm just delighted to be working with Sport for Confidence on this. It is wow. Already, so thank you everyone. Oh, thank you. there's claps. Just to say, so this only began in June, so this is really new. This is really new. This is really exciting. Already we're reflecting, as you'd expect us to. Number one, capacity. I think I've probably said my piece already, that we need all across the country, we need to be working together. These are big issues, but we need a holistic involvement, everyone being enabled, educated, enabled and empowered to play their part. One of the big things I think we both think that we are trying to do is point number 2, is focus on changing the narrative around meal times and around meals for those who are being supported. So rather than, in my experience, often meals are, oh well that's quick because they're going to do something else, or they've got to get on, in the minibus to go somewhere else. So the focus is never, it seems, or sometimes not, on the meal and the mealtime, and empowering everyone to play their part. So as you heard Victoria saying, we're trying to reduce barriers or problems. So the sensory elements on the menus, we're mindful and very, I think, quite knowledgeable about things that can go wrong. So we're trying to remedy that. And as a dietitian, I hope that if we can focus on the meal times, then perhaps there may be, if people eat well at meal times, then there may be less need for snacking. There may be more time spent on that, and then less time being bored and need to snack, hopefully. Number 3, allowing people to play their role. We often reflect as a team. We're quite an unusual trio. The 3 of us mainly working on this project, and we often giggle away and delight in that. And I'd like to say thank you to Sport for Confidence, because they're allowing me to be me and be creative. And we often say it's a pilot when we're saying, can we do this? Can we try this? And we're going, yes, we can. And it's absolutely joyous, and I really hope that we will help to make a positive difference in what we're doing. Victoria, you're on 4 and 5.
Okay, so I think something that we didn't really expect that has come out from this is these further opportunities. So we've been looking and linking with the primary care networks and annual health checks, and it's actually allowed us to go to Essex County Council and ask them for funding for accessible scales. We're hoping for 12 across the leisure centres that can then be used by the local primary care networks. We're linking with larger community groups, and we're building organic relationships with staff who are often emailing and asking for advice, and things that are really lovely that we didn't expect we would be a part of. I think definitely for me, it's a little overwhelming that this is actually just the beginning, and we're just touching the tip of the iceberg. Yes, we've created a training program to support that of the e-learning for health, but actually this is a nationwide issue, and it's just knowing how can we keep this momentum growing. And this is a topic that's much bigger than us, but we're having fun while we do it, and definitely we've worked out that there is a need, and just getting people engaged and motivated and empowered while having fun, I think, has become a little bit of our ethos. So that's us at Good Food, Good Moves.